Hello and welcome to today's video about healthcare and health scares while traveling full-time or part-time around the world. I'm Peter,
And I'm Elena.
and we are Retire Everywhere. We've been traveling the last 3.5 years, and we've had our share of health emergencies and scares and just regular old healthcare. And we wanted to share some things we've learned and how we are handling things now, or at least we're trying to, after another issue that we had to deal with that taught us that we'd kind of forgotten some stuff. So, several times over our travels, we have needed healthcare, sometimes in emergencies, sometimes just needed to get checkups or regular healthcare routine stuff. And we kind of figured out that there's some things you need to do if you're traveling around. First and foremost is have a plan.
Yes, most of the times when you're traveling, you don't even think about what if some accident or something that you don't expect happen.
And it's really, you don't want to think about those things, but especially if you move into a more extended travel, you really have to plan for those. It's going to happen, hopefully nothing major, but sometimes it happens. We were in the hospital recently and there were people with, scooter accidents and major illnesses or other things happening. And sometimes they can be very scary and very bad. And if you don't have a plan, then you don't know what you're going to do. And we, unfortunately, just went through it.
Yes.
So when you're traveling like we are, when you're jumping to multiple countries throughout the year, you kind of have to have that plan and you have to update it. That's the other part of that step one, is just making sure that you have your plan and you update it when you figure out where you're going next. Number two is
Have an insurance. That's something very, very important. Uh, Safety Win is the insurance we are using right now, and it is a travel insurance.
Yeah, we actually have a couple of different policies, one to cover the travel insurance portion and one for Safety Wing for our health insurance. Now, they do have both in some of their plans, but just depending on the situation for us, it made sense for us to have separate plans. But even if you're going on a vacation, you need to at least get travel insurance. Do not expect, if you're leaving the United States or Canada or whatever, don't necessarily expect that your insurance is going to cover you everywhere in the world. It might not cover all the costs. It might not cover you at all. So be very careful and check. And if you're going to do any sort of extended travel, it's worth the small amount of money they charge for that insurance. Sometimes it just covers your bag being delayed or lost, some damage to some of your stuff, or heaven forbid, some major health issues.
Yes. Number 3.
Yeah, make sure you know, at least in general, where the local hospitals are around where you're going to stay, what kind of hospitals are. Are you eligible to go to them? Some of these countries, you've got to go to the right type of hospital. Know what 911 is in the countries you're visiting, because we're here in Vietnam. They don't have a single number. They have 5 different numbers you have to call depending on the type of emergency. We didn't know that. There also are things about the laws, the payment systems, insurance coverages, how whether you have insurance locally, whether they can bill. Depending on where you are in the world, there are different situations. So a little bit of research will prevent you a lot of headache and heartache, and hopefully no financial loss if something does happen.
Yeah. And one more thing I want to add to that is it's very important also to make sure the hospital they're going have a translator or a person who can explain to you very well about the situation, because that's one thing we don't even think about it when we were at the hospital this time, but because it says it's international hospital, you assume that everybody's going to speak your language, and probably not.
No, no. And that's one of the things. That's why you do want to know where the private and the international hospitals are. They cater to international tourists. Some of it is medical tourism that we have talked about before, where you simply go somewhere to have a procedure done. In our case, we went to Bangkok and had our healthcare annual checkups done there. A lot of people do it throughout Southeast Asia, but we've traveled around the world. We've had healthcare around in all sorts of different countries, and we'll talk about that in a little bit. But yeah, the translator thing is a big issue. You go to some public hospitals, and it's a little difficult to do the translation. You don't really want to be have to pull up Google Translate on your phone to talk to a doctor if you don't have to. So the final thing we want to say about preparation for your travels is the U.S. State Department. This is for Americans, but I'm sure in other countries you have something similar with your country. Is they call it the STEP program. It is the Safe Travel Enrollment Program, again for Americans, and you basically provide the State Department your itinerary, or at least a general itinerary, and they will alert you on your phone if you have any, if there are any natural disasters, emergencies, et cetera, happening, and civil unrests can happen. So you get alerts from them. Also, they know you're in country, so that if you need help, they kind of like already know who you are, and you've registered your passports and your information. And so if something does happen and they get reached out to by your significant other or something, at least they're prepared for you. Now, there's two types of healthcare. The health care versus health scare. So in healthcare, what we call general healthcare, preventative healthcare, or just maybe you get sick and you just need to go see somebody. It's really helpful, as we said, if you know where the hospitals are, especially the ones that cater to the international clientele, at least know how to get around, know what to ask for. This week we didn't know anything. We were basically in a new city. We'd just been here for a few days. The thought of needing a doctor on a beautiful sunny beach area just didn't occur to us. And thankfully, we're staying in hotels now, so the hotel was able to help us. But you can also look at, or you can ask local folks, hotels, your Airbnb hosts, you know, maybe local police officer if you need it. For general healthcare, just get referrals.
Mhm.
Another thing we've done is the Google review.
Yeah, the Google review is something that sometimes you don't even think about it, but it will give you an idea of what is the best place to go. But definitely, especially for us this week, the information from the hotel about the international hospital, where they knew it was an emergency room, it was very professional service. So we're very lucky that
Yeah.
we get that information from them.
Yeah, absolute world class facility, all the latest equipment, English speaking staff in many areas. The ones that didn't, they had a translator for us because they knew we didn't speak Vietnamese. Um, anyway, so yeah, the Google reviews, we've actually found a few things as we've traveled that have helped us. Either the Thailand hospital that we ended up picking, we got several reviews before we went, but we decided to show up and actually see the facilities before we booked our appointments.
Mhm.
And then the other thing you can do is talk to your insurance company, whether it's a travel insurance or a safety wing type of international or Cigna or some of the other companies, or if you are relying on your American healthcare company, many of them have international operations now and support. So you can ask them, I'm going to be in this area, this country, where should I go if I have an emergency? Um, Now, if we have a health emergency, what do we do then?
Yeah, that's one of the most scariest conversations that you normally don't want to have,
Yeah.
but it's a must do because, well, I can't even imagine if something happened to Peter and I'm in a foreign country. Uh, I don't know. For me, it's just it can be the worst nightmare.
Yeah. And that's one of the things we've realized in looking through our plan is we really hadn't done a very good job updating it for our newest travel. And so again, thankfully we're in hotels where they have concierges and English speaking staff and they take care of us amazingly well. But so you need to know that emergency number. For example, many countries 911 is actually 119. Um, but sometimes it's 111, and Vietnam actually has five different numbers, 111 through 115 for,
Different
yeah, whether
emergencies.
you want fire or health emergency or police or whatever. So, you
Mhm.
know, that 10 seconds of research before you go, or maybe when you get somewhere, will help you in the end. But you better know how to write, put it in a note in your phone or write it down
Mhm.
somewhere that you can get to it.
It
So
doesn't hurt to have an extra information though.
oh God, yeah.
Yeah.
So the second part of obviously if you have a health emergency is get yourself to the hospital. Around the world, hospitals are not the scary place. that it is in America, and I mean that from a financial aspect. Showing up at a hospital in most of the rest of the world will not bankrupt you. I
Hmm.
hate to disparage the U.S. healthcare system, but if anybody of you have had to go to a hospital there lately, you know what I mean. If you have an ambulance ride, it can cost you thousands of dollars just to get to the door, and that's before anybody who glances in your direction sends you a separate bill. At least according to friends who've been there recently, more recently than we have. So, but yes, get yourself to a hospital, get checked in. They'll take care of you. If you're in an emergency situation, they'll get you right in to see somebody. We've never sat and waited for hours like we have in other
No,
back at home. So
no. The most important thing, always in an emergency situation, have your passport with you.
yeah, and also your insurance details. It's a little bit of a pain when you're traveling around, but it's worth the effort to either print out the little card that you'll get with your online insurance, or make sure you have your insurance card if you are relying on your coverage from home, or your credit card might provide some insurance. Make sure you have that information readily available, and that your significant other knows where to get it.
Exactly. And if it's easy for you, just print in a small card, if you have any allergies, if you have chronic conditions, the medicines that you're taking, if you have any prescription that you have to take every day, who is the emergency contact? And in that case, it will be good for each of you or both of you. That's very, very important.
Yeah, and you really, I mean, unfortunately, when you travel as a couple like this, if something happens to one of you, there's a decent chance it's going to happen to both of you, and you really need another contact either at home or especially the American consulate, and that's why you want to have that information available to somebody who finds you. I mean, imagine you're unconscious, who's going to
Hmm.
tell them what to do? And so, again, and especially if you're traveling alone, that's even more important. If something happens to you, you're not able to communicate with anybody, being able to hand them a card. Now, if you want to go to all the effort of putting it in a foreign language, of the country you're in, you're two steps ahead of us. But if not, at least in English, most everybody now knows how to use Google Translate or some other app that will do it for you.
Exactly. Yeah.
So I want to give you a couple of examples before we wrap up the video. Good and bad examples. And we're going to start with the bad because it's fresh in our mind, because this week we had to go to the hospital for um, significant pain. And
Yeah, long story short, I start with a small pain in my low back and I
was
didn't put attention.
me.
I didn't put attention. Honestly, it was 3 days that I was having the pain start to increase. And I was like, man, it's nothing. And I comment to Peter and he said, well, maybe you have some stress, some tension, why you don't go and get a massage? Well,
Wait a minute.
went to the
It was my
massage.
fault.
No,
Great.
no, I actually thought, okay, it's been like 2 weeks since I got my last massage. So why not? Let's go and get a good full body massage. And like I wasn't expecting that these guys over there, because in the beginning was one and then it was two of them, stretching me and moving me in the ways that you don't even imagine, to
Yeah.
the point that they irritate one of my disc.
Yeah, I
And
think I think you had an irritation. I think they
they,
irritated it further. Yes,
yeah,
we're not trying to blame them. The massage
no,
was a bad choice when
exactly.
you're having pain that you don't know what it is. And
Yes.
Elena hasn't had that kind of pain in that spot before, and so it wasn't very bad. So we didn't think like, oh, we got to go see somebody. We just thought a massage. You're in Southeast Asia. It's cheap. Just go get a massage. And they basically, do this whole stretching thing here in Vietnam that
Yeah.
I don't even want to imagine it, let alone get it done. But yeah, it ended up that it was a pinched nerve basically in your back. Or
Yeah, to the point that yesterday I cannot walk and the pain was horrible. And we decide finally go to the hospital. I wake up in so much pain that I told him, take me to the hospital. So uh, don't wait until the last minute, please.
yeah, so that's a bad example. One, we had no idea where to go. We didn't know the hospital that was around us. As I said, thankfully the hotel, took care of us. We're at the Intercontinental, so using points again. But yeah, they absolutely knew exactly what to do with
They're
us.
amazing.
Got us a taxi, got us over there. They had a wheelchair available if she needed it. But she had to be tough and walk. But Yeah, don't go through that, especially if you're staying at an Airbnb or something. You want to make sure you know what to do.
Hmm.
So now we do have some good examples. um, we've used general healthcare, that kind of preventative slash, you get the flu. We caught COVID a couple of times, but we're vaccinated. So, thankfully it didn't hit us very hard, but we use it around the world. I mean, we lived in Portugal for a year. We had several bouts of flu and things like that. And
Yeah.
a few other just general healthcare issues. We had the dental situation in New Zealand.
Hmm.
And then the other was,
In Bali, we get a flu again.
and then in Thailand, we got COVID again. And yeah, so we've been able to, find a clinic that was in the building that we were in, the hotel we were staying at wasn't part of the hotel. We found hospitals nearby. We've, gone to, the clinic in the resort area. Some have overcharged us ridiculously. Some have been great. Um,
Yeah, one of the things that I want to add to that, because when I get the flu in Bangkok, we don't know where to go,
yeah,
and that's the first problem. So we're in a hotel. We ask the hotel. The hotel says, "Oh, we have a doctor office downstairs. If you can go there, they will take you right away." Well, it was very, very, very expensive.
yeah,
Well, thank God he gave us the medicine and all that, and I can recover in a week. But it was super expensive.
yeah.
That if we were prepared with the hospitals that we can go, the price was probably going to be half.
Yeah, we could have paid for a limousine to take us to the hospital, gotten a room
Because
and
we
drugs and food, and still paid less than we did for the little clinic downstairs. But
Yeah,
it
because
was
we
convenient.
also we find out later that and it was a hospital like 10 minutes away,
Oh yeah.
a
Well, there's
really good hospital.
yeah. Bangkok
So
has hospitals all over. They have numerous private hospitals again for that medical tourism piece. So
yeah.
yeah, and we did our health checkups in the hospital there in Bangkok as well. And again, it was great experience. We actually visited a couple of them, which is something I do recommend if you're going to do that medical tourism. Don't just sign up online for one
No.
particular hospital,
Yeah.
no matter who recommends it.
Look
So
for different options, different prices.
yep, and I'll put the name of the hospital down in the notes if you care to see what we did.
Mhm.
Um, and then, just to go back to the beginning and reiterate, I'm a project manager by training. So the old saying is, if you fail to plan, you're planning to fail. And healthcare is not something you want to fail at. So have a plan, document what you need to do, update it when you change countries,
Mhm. Yes.
and then just be smart. I mean, hey, you like to dive, you like to jump out of airplanes, you love to rock climb, whatever your thing is, great. Congratulations. But the more dangerous the activities you're doing, the more you need to know what to do. It could be stepping on coral out here in this gorgeous ocean and you got to go to the hospital. It could
Mhm.
be, you rent a scooter and you have an accident.
Yeah.
It could be, you get sick or pinch a nerve and you have an
Mhm.
emergency run to the hospital. So do yourself a favor, have your documentation in order, know what you're doing.
Yeah, and not just when you're travel with your partner, but most more how you say this?
More importantly,
Exactly. Excuse my English. More importantly, is if you're traveling alone, I mean, that is the first thing that you should have with you.
yep. Yeah, absolutely. And make sure there's a contact there that knows who you are, what you need, and for God's sakes, your blood type, your allergies, especially if you need medical allergies. So, but stay safe, enjoy the travels. The world is amazing,
Yes,
and
please.
we haven't found a place that doesn't have good healthcare. So,
Exactly.
you know,
Yeah.
that's us. We're not going to those places,
No.
not at our age.
So if you have any questions, please leave us a comment.
Absolutely. Happy travels.
Bye.